Okay, for this assignment, I'm going to be doing views for the forearm, the elbow, and the humerus, as well as there are special views for the elbow. So what I'm going to start with is the AP forearm. And so basically I'm going to be you'll be having your forearm flat out, palm and hand supinated, central ray perpendicular across to the midpoint of the field. So having the X-ray right here, perpendicular across. Usually for this projection, we're viewing the radius, ulna, distal humerus, and or proximal row of the carpal bones. So if that were the case, I would probably slide this up just slightly. Next, I'm going to be doing a lateral forearm view. So for this, I'm going to be positioned so that my humerus and shoulder are parallel to the table with the forearm. My elbow is actually going to be flexed at 90 degrees. So it would be like that. And the central ray is directed perpendicular to the midpoint of the film space. And with the lateral projection, I'm going to be observing the radius, ulna, distal humerus, and proximal row of carpal. That being the case, I'd move that up as well. Next, I'm going to be moving on for views of the elbow, and for the elbow, I will be using a 10x12 cassette. And first, I'm going to be doing AP elbow, so I'm making sure that the elbow is actually in the field of where the central ray would be located. And my hand has to be supinated to prevent rotation of the radius or the ulna. And center of the elbow joint to center the image receptor. Central ray is directed perpendicular to the elbow joint. Elbow joint being right here. Central ray. Next, we'll be doing the medial oblique elbow, and that's with internal rotation. Off with the medial oblique, so that's where I'm going to start and finish off. Medial oblique, I'm going to have my arm extended. At first, I'm going to have my palm supinated, and then I'm going to be pronating the hand. Central ray should be across the epicondyle of the elbow joint, and I should be at the center of the film. Yeah, so, and the central ray directed perpendicular to the center of the elbow joint through the center of the film space. Next, I'm going to be doing the lateral oblique. So this, what you want to make sure is that you're externally rotating the hand so that the line through the humeral epicondyles are about 40 to 45 degrees. So when I do this, it's going to be flat out like this, and you're going to be externally rotating and still making sure that the central ray is perpendicular to the midpoint of the elbow joints. Next, I'm going to be doing the lateral elbow. So here you are just making sure that the elbow is in the center with the central ray perpendicular to the midpoint of the elbow. The patient is seated with the elbow flexed 90 degrees and the shoulder is dropped in order to maintain a parallel relationship between the plane of the film and the humerus and the forearm. We will now move on to the special views for the elbow. For the first one, it's going to be Jones, which is acute flexion position for the olecranon. And in this case, basically, the arm is centered like this. So the elbow is actually flexed, and the patient is also still seated with the fist resting on the patient's shoulder. And the central ray is directed perpendicular to the humerus, approximately 2 inches superior to the olecranon process. And with this demonstration, the forearm and humerus should be superimposed with no rotation whatsoever. The next special view will be the Holly method special exam. The patient in this, it's very important that they cannot extend the elbow. So in a lot of cases, they'll use a sponge to rest the forearm. In this case, I'm going to be standing and kind of give, rest on top of where my elbow would be. Making sure that the central ray is directed perpendicular through the elbow. You're wanting the distal humerus parallel to the film, centering the condyloid area of the humerus. So sometimes you would need that sponge to provide the support for the hand for that to be there in this actual view for that distal humerus. And then lastly is the coil-lateral view, so the radial head and the capitulum. And then the coil-lateral view for the coronary process and the trochlea. So there's actually 2 lateral views for this. So the patient would be seated with the elbow flexed 90 degrees and the shoulders actually drop to maintain a parallel relationship. Forearm at wrist is pronated to the PA. So the elbow is at 90 degrees. Like this. So when I had the central ray, should be going through this, through the joint still, with the palm down. And making sure you have that 90-degree view so there's no gapping in between.